So I've heard of Botox and I've heard of filler, but which one do I actually need, or do I need something entirely different? I'm Dr. Abs, and that's what we're looking at today. Essentially, Botox stops things moving and filler makes things bigger. But if you see a part of your face that you don't like, how do you know which one to get, assuming it is one of those two things that you need and not some third other thing? In fact, if you've had these questions in the past, let me know in the comments below what you ended up doing. So Botox is generally, but not always, used in places like the forehead, between the eyebrows, sides of the eyes. Sometimes we even use it in places like the nose, the chin, even the neck. There are loads of places. We tend to use it because wrinkles are partly, never completely, formed by the skin contracting back and forth in particular areas like, for example, the forehead. Whenever we look surprised, we scrunch the skin upwards and back down again. When we do this again and again and again, it can make it easier for wrinkles to form. So the theory is if we put Botox inside the muscle responsible for that movement, we don't make that expression as often. And by not making it as often, the skin isn't bunched up back and forth again and again and again. So the wrinkle either doesn't get as bad or it doesn't get formed as easily in the first place. Filler, on the other hand, is a volume tool, something that you inject to make a certain area bigger. For example, we can put it in the nose to smooth out a bump, we can put it in the chin to bring it forward, we can put it in the lips to make them look more full, we can put it in so many different areas. But here's where people end up making regrets and sometimes end up worse off for having the treatment. If you see a wrinkle on your face that's appearing, for example, when you look surprised, it's a wrinkle that's only appearing when you move, when you make an expression, in which case it makes sense that Botox can stop you making that expression and the wrinkle can stop getting worse. But if you see a wrinkle that's there, even when you're at rest, even when you're not making a facial expression, then Botox isn't really going to do anything. And this is because Botox just keeps you at rest. So if your wrinkle is visible even at rest, and Botox just keeps you at rest, it's going to keep you where the wrinkle is always visible. It's not going to do anything for you. And in fact, there are patients everywhere that always go back to their doctor and they say, it didn't work because the wrinkle's still there. Why? No, it did work, but you just didn't understand that Botox is a muscle freezer, not a wrinkle eraser. And if that describes you after having some Botox and the wrinkle is still there, you never understood why, tell me in the comments below if it makes sense now. And if you are in that boat, you're probably thinking, all right, so Botox isn't for me, so filler's right for me, right? Not necessarily. Why? Because filler is injected deep to the skin, underneath the skin, and makes that entire area bigger. The wrinkle isn't underneath the skin, it's within the skin itself. Now, if you try and inject the filler directly into the skin itself instead of underneath, like in the fat or the muscle, all that's going to happen is the skin's going to be flat everywhere, and then suddenly there's going to be this big raised area in the middle where you've injected, and it's going to look like some sort of sausage has just been trapped underneath the skin. So listen really carefully if you want to avoid as many regrets as you possibly can, if you want to avoid a botched face. If you've got wrinkles at rest, not just when you're making facial expressions, then what you need isn't a frozen face or an inflated face. What you need is better skin. You need skin quality improving treatment. Let's sneeze. Oh, outtakes. And there are so many options out there nowadays to do that. To give you a rough, quick idea, you're always going to need skincare whatever you do. Things like LED therapy and microneedling are some of the best things you can possibly do. LED therapy especially is incredible for your skin. As well as that, there's things like radio frequency, fractional RF microneedling, lasers, and so much more. I'm definitely going to be doing more videos on that in the future. But for now, just remember this golden rule. If you value your appearance and you see a part of your face that you don't like, please, please, please do not fall into the trap of assuming that there's some syringe out there filled with magic fluid that you just inject, it makes everything disappear and you've got nothing to worry about. That doesn't exist. Even simple things like Botox and filler actually can have really negative consequences for the long-term aging and or the long-term appearance of your face. And I'm definitely going to be making videos on that too, so stay tuned. If you want to see how things like Botox are injected, click on the next video now. Otherwise, thanks for watching and subscribe if you want more.